Well, good afternoon, good evening to each one of you, Save the Mothers alumni, those of you that are online, those of you that are here in person. It is such a joy to be with you. We have anticipated today, and we're so excited that each one of you are here and hear all the wonderful things that so many of you are doing. I also want to thank the faculty here at Save the Mothers as well, too. Just listening to Dr. Eve speaking, I have listened to her lectures for years and years, and every time I listen to her speaking, I learn more. So thank you for the faculty that are here. For many of you that are friends that have come today, we're so excited and happy that you're here. Our Save the Mothers board, I thank Honorable Sylvia Sinabulia. It's just so wonderful to see your own alumni taking these wonderful positions. And I remember when Sylvia first came back in 2005. And of course, I didn't really understand the educational system here in Uganda. And I remember she was kind of torn because she was trying to get her kids into school. And I thought, February, why are kids going to school in February? Because our system in Canada is so much different. But she persisted and came through, and here she is, the chair of the board. So we're so grateful to her and many of the other board members, Josephine and others. I want to thank the Save the Mothers leadership, Dr. Edward. Again, we've worked together. Edward, I don't want to say it, but it's getting close to 20 years almost. And so it's just been wonderful to work with you. For the UCU leadership, Dr. Miriam. Again, we've worked together, Miriam, for many, many years. And so just grateful to the UCU leadership. And I know the Vice Chancellor sends his greetings as well. I had the privilege of speaking with him yesterday, and he's really very supportive of the Save the Mothers program. I wanted to add on to Dr. Makosa's comment about the vision of Save the Mothers and the people who so much contributed, and a couple of them that are not with us here today, but as he mentioned, Dr. Marimbi, who I had the privilege of meeting back when I was a young girl. Well, I was not that young, but young enough. And it was what a privilege to have had a lifelong friendship with Dr. Marimbi, Dr. Pius Okong, who again, I just have so much respect for, and Dr. Olive Sintumbwe Magisa. Again, these people who've been your lecturers, they've been friends, they've been colleagues, and we're really grateful for them. Well, let me just take it for a few moments. I know people want to get to that food, so I don't want to speak on too long. I wonder if we could put the lights down just a little bit. I don't want people to go asleep, but maybe we could put the lights down a little bit just so we can see the pictures a little bit better. But reimagining safe motherhood post-pandemic. What's our role as Save the Mothers? And the phrase I would love to use is pillar people. Can we be pillar people? And let me talk about that in a little more detail. Well, I'm so glad to see so many of you back. This is just a smattering of some of the classes of the Save the Mothers program. And in fact, some of you may not know, but that building right over there, Mari building, is where we first started the Save the Mothers program, where we first had our classrooms. But for many years now, I think it's up to 19 years now, we've had Save the Mothers graduates, and we're grateful for the new Marimbi building. It's not so new now, but in our own place to actually meet with our students. So again, I'm just so excited to see so many of you here today. Well, what are we going to talk about in the next couple of minutes? Well, just a few things. First of all, just being familiar with the changes that have impacted safe motherhood as a result of the pandemic. Just talking about a little bit about players who are advocates to bring change. And finally, just what is our personal role in improving safe motherhood? How do we become pillar people? And we'll talk a little bit more about that. Well, the world is not the same post-pandemic, is it? Lots of things have changed. We see people being very fearful. I know of people who literally still do not come out of their houses in Canada because they're afraid of the pandemic. People that won't socialize with other people, people who have a very hard time accepting any kind of truth. What's really true? They don't believe that anything is true. It's very difficult to give health messages when people don't believe that something is true. So it has really changed the way people think. There's a lot of mistrust, social isolation. We see this with our medical students at McMaster where I work, where students literally haven't been communicating with people. And so they've become very sort of isolated, and it's difficult for them to communicate. We see a lack of community. We see shortages sometimes, and definitely higher costs of everything. And I know that's happened here in Uganda. I was at the supermarket recently, and when they asked how much, they gave me the total at the end, my jaw just hit the floor and see how expensive things were. But again, same thing has happened really around the world. So these are some of the realities of post-pandemic. But having said that, the world is the same after the pandemic. The world is actually the same in that mothers still need competent and dignified care. Babies still need attention at delivery, and people still need community. These things are true. Yes, things have changed, but the basic things of life are still very much the same. I just want to go through just very quickly this important slide from Peter Waswa, who has shared it with us. And of course, Peter's been one of our Save the Mothers faculty. The unfinished agenda here in Uganda, and all of us know these numbers so well, the 6,000 mothers dying every year of pregnancy-related complications, the 39,000 babies that die, those that are stillborn, and then finally the children that die or are stunted as a result. This is the agenda that we had before the pandemic, and it's still the same agenda that we have today, isn't it? And as many of us who follow Christ and love Christ, God has given us this agenda. This is our agenda in our lives, is to answer and reach out. We have the skills, we have the training, we have the voice to make an impact on this agenda. But as we do that, we look at this huge agenda and think, where do you even start? Well, first things first is prioritizing safe motherhood. That is really the future of any country, isn't it? Any country that doesn't have safe motherhood, you're going to have children that are going to be impacted. So with all the other strains that are on our system right now, all the things that are pulling our attention, safe motherhood has to be right up at near the top. But how do we make that happen? And of course, that is a challenge. And what a joy to listen to so many of you talking about the programs that you have been involved in to make that happen. Well, I live near Niagara Falls, less than an hour from Niagara Falls, and this is a picture of Niagara Falls. Sorry, again, you can't see it too well, but here's this guy walking along a tightrope across Niagara Falls. Now, some of you have stood beside Niagara Falls. It is an amazing force of water. I've been down on a boat near the bottom there. You can get on this boat and go, and you are just overwhelmed at the power of that force. And here's this guy, Nick Walanda. He trained his whole life. His whole family had been these tightrope walkers. And this guy trained and walked across Niagara Falls on a tightrope. He had to be steady. He had to keep his balance. You know, there's birds pecking at him. If you can imagine that high up, there's birds, there's water blowing on you, there's wind blowing on you. And he had to go the distance. And in many ways, I feel the same for safe motherhood. You know, we're going to have lots of things blowing against us. We're going to have opposition. We're going to have challenges, but we have to go the distance for mothers. Well, I know many of you know this story, but I think just we need to remind ourselves the Millennium Development Goals, which when some of you were first started the program, were in place. The 8 goals, and safe motherhood was goal number 5. We were supposed to reduce maternal mortality by 3/4. And again, we reduced it somewhat, but we didn't meet that goal. And now we've transitioned to the Sustainable Development Goals. And we know that 2 of those goals are related to safe motherhood. But really at the end of it, at 2030, we are supposed to have the global maternal mortality at 70 maternal deaths per 100,000 live births. Now, I don't know about you, but 2030, it sounded like a long ways away. And then Dr. Miriam, I was just calculating, it's 2023 today. We got 7 years to reach this goal of 70 mothers per 100,000 around the world, here in Uganda and around the world. So we have a long way to go, but that is the goal for us. And again, just reminding those sustainable development goals, dealing with much more than just safe motherhood, but many of these goals, as we already talked about, importance of water and safety of water also is involved in the sustainable development goals. Well, let's just back up for a second and think about how has the pandemic changed our approach to safe motherhood? What has been impacted? How do we strategically try to reach this goal of 70 per 100,000? Well, the supply chain has been hit, hasn't it? And this photograph doesn't show up too well, but we know that we have to produce the chemical, then it gets shipped to a place where it then gets put into its form, then it is shipped again, and then you have to send it over to the hospital eventually. So there's all of these different links in the chain, and we could see during the pandemic how one break in that link and the whole thing fell apart, didn't it? We see workforce fatigue. We certainly see this all around the world. I work at a clinic in Canada, and we initially had 9 nurses at the beginning of the pandemic. Do you know how many of those nurses were left at the end of the pandemic? 0. Literally all of our nurses left during the pandemic. Now we get one here, we get one there, try to replace. But my point is people have left in large, large numbers. So we are now dealing with how do we build the workforce again, and not only just grab anybody. Hey, Josephine, will you come and work? Or hey, Dale, will you come and work? No, people who, and you guys would, I know, would be very dedicated workers. My point is we need people who are really dedicated to this, who really understand what it is that they're doing and are qualified to work in safe motherhood. So building up that workforce is very important. People who are really committed to the work. The quality of training is so important. Again, I see this in the medical students coming through. Like, again, these poor students don't even know how to talk to patient, Dr. Edward. Like they kind of, they just haven't had any social experience. So we need people who are going to be trained well. And this is a real challenge because for several years, we basically have not necessarily been having the quality of training that we were hoping for. General fatigue with health facilities. People are just sort of a little bit tired of going to health facilities and feeling like they aren't getting the care that they need. So again, how do we improve customer service? And I really myself have changed very much how I approach people in the hospital. And, I sort of think about when people come into a restaurant, I always use the example of McDonald's in Canada. People love McDonald's, and every McDonald's you go into, it's a hamburger place. You always know how you're going to be treated. Somebody behind the counter is always going to smile at you. Somebody's going to greet you. And I think, why don't we do that in a healthcare facility instead of just sort of saying, hey, why are you here? It's just, hey, good afternoon. How are you? Thank you for coming today. And I often say that to my patients. Thanks for coming today. Meanwhile, it was actually me that was working to serve them, but thank you for making the time. So again, we have to change even the environment that we have in the healthcare facilities. On a positive side, Dr. Eve had pointed this out before. In some ways, we've got more facilities than we had before. Ventilators that you need to help people breathe. Again, around the world, there's been more ventilators. And you say, well, how does that have anything to do with safe motherhood? Well, actually, we sometimes need ventilators. Sometimes mothers get very, very ill and need to actually be ventilated. So that's good that we now at least have more of those. And we had lots of lessons learned through the pandemic about how best to use our resources. And maybe in safe motherhood, that's something that we need to think a little bit more about, isn't it? Well, we need to understand the changes that are going around us in order to optimize our impact. So the first things first, mothers and babies should not be dying. And that's our role in terms of advocacy and speaking that message. Sometimes when you've got a message that you keep saying over and over and over again, you sometimes get a little bit tired. Does that ever happen to you? Yeah, you sometimes get a little bit tired. But you know what? It's the message that we need to keep sharing. It's like sharing the good news of Jesus. You just got to keep sharing it. You got to keep letting people know. And we need to keep speaking for mothers, because even today, there are how many hundreds of mothers today in Uganda that are delivering, and each one of them today need the care that they deserve and need. And here's my final challenge to you is that we can be pillar people. And what do I mean by this? And Dr. Miriam shared with me a little bit what a pillar means to her. It's about being present. It's about being reliable. When people look at us and say the mothers, do they see people that they can lean on? Do they see people who are going to be trustworthy? Do they see people who know what they're talking about? And you think about a pillar, we even see in this room here, we've got these pillars. If all 4 of these pillars went, the whole roof would come crashing down on us. Now, I don't think there's anybody who walked in here today and looked at those pillars and said, wow, I'm glad those pillars are there. But I tell you, if those pillars weren't there, the roof would be on our heads, right? And so as people who are supporting safe motherhood, we need to be pillar people. We need to be there. People aren't necessarily going to notice us, but our voice and our strength is going to be there supporting the mothers. In the Bible, it talks about James, Peter, and John. They were pillars of the church. And because they were pillars, the church multiplied. And it is what it is today because of these people who were pillars. And may we be the same in our place as well, too. Those pillars have to understand change. There's change going on around us as we hold things up and try to improve things. So I just want to quickly use this model, and some of you may have heard of this before from Jeremy Schiffman, but it really helped me to understand when we're advocating for something, what do we need to understand in a more full manner? Well, he talks about the actor power, he talks about the idea, he talks about a political context and the issue's characteristics. So what do I mean by that? When we think about the actor power, we're talking about the individual strength of the organization concerned with the issue. So in other words, again, sorry, you can't see this so well, but this is an airplane. You remember when that Malaysian plane went down? Everybody paid attention. Remember how much was in the news about the Malaysian plane? For weeks and weeks and weeks, it was the front of the news because everybody was worried. What in the world happened to that plane? And why do we care about that plane? We care because you and I might be on a plane one day and we don't want our plane to go down. We want to find out what happened to that plane and don't let it happen again. So again, it bothered the whole world that this one plane went down. When meanwhile, that very day, the same number of mothers died of pregnancy-related complications, but people didn't really pay that much attention to it. We look at the pandemic. The world paid attention to the pandemic. I don't know how things were here in Uganda, but in Canada, everybody's like, that's a problem over there. And then all of a sudden, it came to us. And I can tell you, it really got people's attention then, didn't it? So again, the actual actor, the people that are involved in it. Unfortunately, in Safe Motherhood, we see women, and again, you can't see this very well, but here's a woman holding her bucket. She's got a fistula, right? She had an obstetric complication, and now she's got a hole in her bladder and she's leaking all the time. This woman was up near Fort Portal. And I'll never forget meeting her, thinking, here's this poor woman carrying a bucket around her whole life. 2 million women worldwide with fistulas. Again, no one hears about them. They're not the airplane that went down. They're not a pandemic that's hit the world, but they're quiet actors. And so we need to be loud for these mothers. How about the idea? Well, the idea is, do we actually agree on what we need to do to solve the issue? Do we actually know what we need to do to save mothers? I mean, arguably we do. We have all the treatments. The challenges, as some of you have shared, is how do we get them to women? So again, we need to work harder and harder at making sure we understand how do we actually get care to all women. We think about the political context of things. It affects how an issue is seen, isn't it? Certainly, again, with the pandemic, it rose to every politician's top of their box is how do we deal with the pandemic? You see it on everywhere, you know, COVID-19 issues. But when we think about the political context around safe motherhood, back in the 1990s, Dr. Merriam and I will share with you, nobody paid attention to safe motherhood. Like Dr. Merriam and I were up in Chiboga together, and you couldn't get anybody's attention to talk about safe motherhood. And then all of a sudden it started to get some attention, didn't it? With the Millennium Development Goals, people started to pay a little bit more attention. But what does happen after a while? Well, people just sort of fold their arms and sometimes forget. And so we need to remember to keep that political context. And we're so grateful for people like Honorable Sylvia, who have again played an important role in the political context here in Uganda to make sure safe motherhood is on the top of the agenda. But we need to keep doing that. We need to keep that stirring the pot for mothers. And finally, the issue characteristics. So can we actually measure what's going on? Are we able to provide the interventions that are needed? And how severe is the impact? You know, there's certain things that people don't really pay attention to, but you know what? Mothers and babies dying, that is something that we should really be paying attention to. So how do we bring change? I wish, Peter, I had a picture of a chicken in that person's hand. Because what's in our hands? We all have to ask, what is in our hands? And for those people out in your village and in your area, it was a chicken, right? But for us, we have influence. All of us have influence where we are, and we can keep speaking for safe motherhood. When I'm back in Canada, again, what is my role? What can I do? I can speak. Wherever you are, you can speak, and we need to continue to keep doing that. Encouraging other people to get involved with the Save the Mothers program. You know, the program is going to be starting again, Dr. Edward. We need new candidates. We need new people to come and join the program. You guys have all graduated and we're just cheering you on. We're so excited, but we need more people coming, both here from Uganda as well as from other countries in the East African area and beyond. So again, encouraging others is so important. Some of you may want to get involved with the Mother Baby Friendly Hospital Initiative. If you're interested, Toby's going to post some information about how to do that. So please make sure that you get involved with that with your local hospital. And finally, faithful prayer and support for safe motherhood. Again, we just need to continue to keep bringing this before God. Say, God, how do we improve safe motherhood here in our communities? So in summary, the world has changed, but the world hasn't changed since the pandemic. Mothers and newborns still need and deserve care. They need good care. There's new opportunities and there's new challenges. And so we as pillar people need to understand what those challenges are and how do we address them. And let us be pillar people, people who are reliable and visible, using our hands and our strength to support vulnerable mothers and newborns. You know, I bring up this picture here because it is such an example of how people's influence goes way beyond their own little world. Here's a picture of our own dear Virginia Plan, who owns a school and runs a school that's close to here, right here. Where's Virginia? There's Virginia. Sorry, I look at Virginia. I won't put the pointer at you there, Virginia. Virginia, she turned her school into a safe motherhood machine. Like, I don't have any other description for it. She had these little kids. They've been up here singing and dancing in front of the First Lady so many times. And you think over the last, 17 years, Virginia, since you've done that, every year graduating 300 kids, whatever you have, 17 times 300. Think about the hundreds and hundreds and hundreds of children that she has put through her school. And these kids aren't educated a little bit about Save the Mothers and safe motherhood. They are educated a lot. And to hear their poems and their songs, like, I would sit there in the audience, Mary, like you, and I would literally cry listening to these little kids talking about safe motherhood. I'm sorry, there is no child in Canada that has ever thought about their mother dying of a pregnancy-related complication. They have never, ever thought of it. And yet here's these little kids talking about it, singing about it here in Macono. The reason I put this picture up is here's Virginia speaking to this member of parliament, this Canadian member of parliament, Charlton. She actually lives very close and worked very close to where I live in Hamilton as a member of parliament. Now, why was this Canadian member of parliament over at Virginia's school? Well, because there was a group of members of parliament, including our own Honorable Sylvia Sinabulia and others, that had rallied and asked for the Interparliamentary Union meeting to be held here in Uganda. And what was the theme of that IPU? I think, what year was it, Sylvia? 2015, was it? Or 2013? I forget what it's 20. Anyways, there was over 120 parliaments from around the world had sent people here to Uganda learning about safe motherhood. And here's this Canadian member of parliament who had come over. She didn't know me. She'd never met me, never heard of me before. She had come over here to learn about safe motherhood from our own influence, our own game changers. What an incredible story of how these women have had an impact. These graduates of Save the Mothers have had an impact around the world. So I just want to encourage you. You might think you've just sowed a little seed, but God can use that and grow a huge, huge tree. So pillar people, thank you for taking the steps to deliver that change for mothers and babies. So excited to see each one of you here today. Thank you for coming. Thank you to the people online for joining us. And may we be pillar people, being strong, being visible, being reliable, and making an impact for mothers and babies. I thank you.